Hi, I'm Pamela D Wilson. Welcome to part one of How to Get Guardianship for a Parent. We're going to talk about the differences in decision-making power between being a court-appointed guardian and a medical durable power of attorney. And I'll share pitfalls that you can expect to experience if you are in these roles. So today's conversation is going to review why decision-making power is important. We'll talk about areas where medical oversight and decision-making is critical. I'll share examples from the healthcare industry, and also the differences between clinical capacity and legal capacity. And this is where the healthcare system doesn't understand the responsibilities of a guardian. They rely on what they believe to be more important, which is clinical decision-making. Also, we'll talk about concerns from the healthcare system about liability and the harm that can happen to elderly parents if you, as a court-appointed guardian, or if you are a medical durable power of attorney, if you're not acting as a very strong advocate for your parent, I'll share what can happen. So decision-making is important for a number of reasons. The first is that there can be conflict in your family about what should be done about the care for an elderly parent. One of your brothers and sisters may think that your mom or dad should live at home forever because that's what they want to do. They may even think that they should be that person that helps mom or dad do that and move into mom or dad's home with them. You may have a different opinion. You may think that mom or dad would be better off in a care community. When you are appointed, that court-appointed guardian, that final decision-making power is yours. There are some circumstances where you may have to get court approval to move an elderly parent out of the home or to do other things. Decision-making power is extremely important with the healthcare system, and part of that arises from the fact that the healthcare system looks at decision-making power a little differently than the legal system. In that case, you have to be the guardian that educates doctors and nurses and other healthcare providers about the decisions that you can make instead of decisions that your elderly parent can make. We'll talk about the duty of care planning. Care planning is part of being a guardian. You actually have to submit care plans to the court. And above the care plan, you have to provide oversight for everyone who is caring for your parent, providing medical care, or even providing in-home care. And advocacy is a significant part of being a guardian. We'll talk about that. So let's talk about the differences when you're acting in the role of medical durable power of attorney versus a guardian. As a medical durable power of attorney, you are considered an agent to the principal, and the principal is the person who appointed you. In this case, we'll say that it's your elderly parent. In this case, you work with your elderly parent to do what they direct you to do, or to do what you know they would have wanted to have done. The caveat here is that if you go too far, or you make decisions contrary to what your elderly parent wants, they can revoke that medical durable power of attorney. They can also revoke a financial power of attorney. Now, I have had situations in my 20-plus year career where parents have done this, where children have overstepped their boundaries a little bit too much, and the parent said, I didn't appoint you to do that. I appointed you to do what I wanted. I'm removing that appointment, and I'm appointing someone else. Guardianship is a little different. Guardianship is a court matter, and while it's possible for a guardian to be removed, a court hearing actually has to happen for that to occur. It's called a show cause hearing, and family members or interested parties have to provide evidence that the guardian is making poor decisions on behalf of an elderly parent. Now, as a guardian, you have a similar responsibility as a medical power of attorney, but it's a higher level of responsibility. Everything you do can be questioned. The decisions that you make, anything that you do for an elderly parent. And it should be able to be questioned because this is a court responsibility. You are there to do what your elderly parent would have done if they could make their own decisions. In either role, a lot of education is important because we don't wake up one day and just know how to be a caregiver and know how to manage care and advocate for care and work with the healthcare system. Either of these roles is a very serious role, and it takes a person who's willing to seek outside opinions, to learn, to take courses, to become educated, to learn about health and diagnoses and the effects of medications and decisions about treatment. It is a huge, huge learning opportunity for anybody who accepts this responsibility. And it's a serious responsibility. You are responsible for the health and well-being of a parent or another adult. Let's talk about one of the first pitfalls of the healthcare system. And I'm sharing these examples so that you can never say, oh, I wish someone would have told me that. I'm telling you the issues that I ran into when I was a court-appointed guardian for my clients. Medications are important for older adults. They're actually one of the top reasons, I think 6 or 7, that elderly parents are sent to hospital emergency rooms. And it's poor management of medication. So it's either a change in medication, forgetting to take a medication, taking too much, not taking it at the right time. But what happens when healthcare providers become involved? Let's say your elderly parent goes to a doctor appointment without you, and the physician says, oh, Mrs. Smith, I don't think you need this blood pressure medication anymore. Your blood pressure seems okay. Let's just discontinue it. Are you okay with that? And of course, your mom will say yes, because a lot of people trust their doctors. And your mom doesn't know to ask the questions of, how would I know if this change is bad? What type of reaction might I have? These are the questions that you as a guardian should ask. And when you are appointed, it is so important to make sure that no medical provider changes a medication, adds a medication, does anything without talking to you first, because it's your responsibility to know why these medications were provided. It's your responsibility to know the side effects, and it's your responsibility to know if there are any interactions with other medications that could harm your elderly parent. I have had physicians change medications for my doctors without asking me, even when there was a note in the chart. And horrible things happened to my client. Health issues, hospitalizations, emergency room stays, all of this is unnecessary if you set up a system to communicate with physicians, let them know that you are the guardian, and make sure that nobody makes decisions without your pre-approval. Another sticky wicket, uneducated healthcare providers. As a guardian, you might assume that everybody that you talk to in the healthcare system is educated, is responsible, and knows a little bit outside of their role. I can tell you that this rarely happens. Not that you shouldn't trust other people, but you want to receive and, more importantly, verify that information is accurate. And I'll share some examples. Health insurance company interactions can be extremely frustrating. They can tell you that a physician is in network, or that a treatment is pre-approved, or they can give you pre-op instructions for something like a colonoscopy or a surgery, and forget to give you the really important information. And when you show up for that treatment, you have done nothing to support that surgery or that treatment happening, and you have to reschedule it, and you have wasted precious, precious time. Or the insurance company tells you that a procedure is approved, and you didn't think to get a copy of that pre-approval. So your parent goes for a treatment, you get a bill for $5,000. The insurance company said, we didn't approve this. That doctor isn't in network. These issues take hours of your time to resolve. And I can tell you that the health insurance companies and the reps that you talk to aren't always helpful. They may give you bad information. You may talk to 10 people about something and one person is to follow through and they don't. This is where documenting conversations, writing down names, and asking for documentation can save you time, money, effort, and a lot of frustration. Let's talk about other uneducated healthcare providers. And this is more about the education that they don't provide to you because you don't know what questions you're supposed to be asking. Assisted living communities, they are that, assisted living communities. They don't provide medical care, even though they may have visiting doctors. They don't provide medical care, even though they may have a nurse on staff who supervises the fact that medications are given. Your parent living in assisted living is expected to be able to take care of most of their daily responsibilities. Things that assisted living does help with: meals, housekeeping, medication management, and a little bit of personal care. The minute your parent starts to need more than they can provide, you'll either get a big bill or you'll get 24-hour notice or 3-day notice saying, we can't possibly take care of your parent anymore. You have to find a new place for them to live. Then we have in-home care agencies, another area where family members have no idea what they're getting into unless you have done this before. The care staff at some in-home care agencies are not very well trained. Other care agencies, fabulous training. I've worked with both, but it is your job to manage these care providers. It's your job to explain what they should be doing for your elderly parents. It's also your job to ask questions about what they can do and what they can't do. They can remind your parent to take medications. They can't hand them a pill bottle. They can't take the medications out of those bottles. They also can't lift your elderly parent. Many families will hire care providers to come in when elderly parents have mobility problems. If your parent can't stand and pivot with a little bit of help from a care provider, a care agency can't do that. And they can't do that most times because of state laws. Now, if you hire a healthcare medical agency that has CNAs who are trained to do that at a higher rate, 2 of them possibly can help move your parent, or they can use a Hoyer lift. It's important to know what all of these medical providers can do and what they can't do. And if you don't ask, you'll never know, you'll make assumptions, and you'll be shocked when they say, we can't do that for you. We can't do that for your elderly parent. So let's talk about decision-making and healthcare bias against the elderly, because this exists. The healthcare system is really set up to treat the young. They would rather treat young people who have a higher chance of recovering from any illness than treat somebody who is 75 or 80 years old. There are very few doctors who specialize in care of the elderly. These doctors are called geriatricians. It's more expensive to go the additional years of school to be a geriatrician. And in some cases, they make less money than other doctors. So there's a very low incentive, at least here in the United States, for doctors who are interested and want to help and treat the elderly. If you can find a good geriatrician, you are lucky. I have worked with many over the years who have been so caring. And I've also worked with a lot of doctors who really didn't care about my elderly patients. And I'll give you some examples. So physicians are limited by their experience. And when I say this, I mean, if a physician has not worked with a lot of elderly clients who have health conditions related to being older, like dementia, they may make the wrong decisions. They may not approve the right type of care. And I want to share 3 stories, my client stories, of situations to give you an idea of how this happens. The first is a client named Herb, and I was court-appointed guardian for all of these clients that I'm going to talk about. Herb lived in a small personal care home, and I would visit him regularly. I visited him one day, and he was doing great. He was up walking, talking. We had a great visit. The next morning, I get a call from the staff at the care community, and they say, Pamela, we think that Herb needs a wheelchair. Can you get one ordered for him? And I was a little puzzled. I said, well, why does Herb need a wheelchair today when yesterday he was fine. They said, well, he can't get out of bed today. And so I went through my normal thought process of identifying why Herb might not be able to get out of bed today. I asked him to take his blood pressure, his pulse oxygen reading, his temperature. I asked him to investigate whether Herb slept well last night. Did he get up to use the bathroom? And any other unusual aspects that Herb might have experienced. The caregivers at the care agency called me back and they said, oh my gosh, Pamela, Herb has a fever. His blood pressure is pretty low. It's about 80/60. And he's having trouble breathing. His pulse oxygen reading is in the upper 80s. So I told the care staff, I said, send him to the emergency room right now. I will go there. I will meet him there. I'll figure out what's wrong. Well, Herb didn't need a wheelchair, but Herb did need treatment for pneumonia. And by the time we discovered it, it had gone pretty far. And pneumonia can do that. So older adults can have significant changes in condition in a matter of 12 or 24 hours. Now, the doctors at the hospital said to me, Pamela, we really need to put Herb in intensive care. And do you really want to put him through all of that? I smiled and I said, Doctor, I know Herb better than you do. I know that if Herb gets antibiotics, he will recover very quickly. And I know that Herb would want it to be treated. He would want to be treated for this pneumonia. The doctors were thinking, wow, an intensive care bed. We'd be better off putting a younger person in there than somebody who's 85 or 90, because the 85 or 90-year-olds may not survive. I had to go so far as to explain to the doctor that I was Herb's court-appointed guardian and to say, well, if something happens to Herb, I'm the one that goes to court to explain to the judge why this decision was made and why this happened. You don't have to do that. So I do ask you to honor my decision-making power as Herb's guardian, put him in intensive care, and treat him. The doctor did. Herb was treated for a few days, recovered amazingly, went home and lived a couple more years. That one was a win. The next story is about Joan. And Joan was another client of mine who lived in an assisted living community. Went to visit her one day. It was 12 o'clock. She's still in bed. I went in there and she didn't look very well. Her face was a little ashen and she was having breathing problems. And this was something that was common for her. She would come down with bronchitis and it would turn into pneumonia quickly. Pneumonia is a very common condition for older adults. So I went in and I said, Joan, what's going on today? She said, oh, Pamela, I'm not feeling well. And I asked her, have you been up for breakfast? Oh, no, I've been here all morning. So I said, well, let me go check with the care staff and I'll be right back. I went to the care staff and I said, what's going on with Joan? Why didn't she get up for breakfast? And they said, well, she didn't want to. And I said, didn't want to? When she said didn't want to, did you think to ask her if she wasn't feeling good? Did you think to do anything? Did you think to call me and tell me? And they didn't, because there's a thing called patient rights. People living in care communities can say no, and the staff is so busy and so hurried that they don't think to look into it. I got a pulse ox reader, and I went back to Joan's room and I took her pulse oxygen reading, and it was super low. Called 911, sent her out to the hospital, of course, pneumonia, and a longer story of being treated for what turned into lung cancer. That lung cancer happened to be very treatable. You may have seen commercials on television these days for something called Keytruda. It treats an immunological type of lung cancer. The doctor that saw her at the assisted living community said, oh, she's old. Pamela, put her on hospice care. What are you thinking, putting her through all this treatment? You're crazy. Her prior physician, prior to moving to assisted living, said the same thing. The cancer doctor, though, was very optimistic. He said, Pamela, she is so qualified for this. Her insurance pays for it. The side effects are very low. It could give her another 1 to 2 years. And so I made the decision to do that because Joan wanted to be treated. She had the right to be treated. The benefit of that was I was appointed Joan's guardian because her family was estranged. Her sister and her children did not get along, and they didn't have very good relationships with Joan. But knowing that she was being treated for lung cancer allowed Joan and her family to reconcile. When Joan passed away in hospice, all of her family was there with her. So there are benefits to advocating for the care of your clients, many benefits other than the obvious. And the last story that I want to share is a story of Elizabeth, and this one is a sad story. This is a story where I didn't win against the medical system, and other caregivers have shared similar stories. This is a client who had dementia who rolled out of bed one day and fell and broke a hip. She was walking with a walker prior to this fall. A surgeon, not a geriatrician, didn't know anything about dementia, was the one to operate her or provide the operation for her hip surgery. And if you know anything about hip surgeries for the elderly, they can do nothing. They can opt not to operate. They can opt to do a pin or a partial hip replacement or a full hip replacement. In Elizabeth's case, all I could get the doctor to approve was to put a pin in. Now, what that meant, and what the doctor didn't think about, didn't even realize, refused to be educated about, was that putting a pin in a hip means that that person has to be non-weight bearing. It means that they can't stand and put weight on that foot, put weight on that leg. And in her case, it was for a period of 30 to 60 days. If you know anything about dementia, routine is extremely important. Walking every day is extremely important. When you take away a skill that a person with dementia has, like standing and walking, what do you think happens? They forget how to do that skill. After the 60 days, when the doctor said, Elizabeth's great, she can stand, she can walk, she can do all of these things. But what happened? Elizabeth couldn't do any of them. She forgot how to walk. She forgot how to stand. The rest of her life was spent in a wheelchair. And if you know anything about dementia and wheelchairs and being sedentary, you know that they can result in something called a skin wound. For the elderly, skin wounds can be serious. And that is what eventually, very sadly, led to Elizabeth's death. So this physician who refused to do a total hip replacement on Elizabeth basically resigned her to live in a wheelchair the rest of her life, and resigned her to get a bed sore so large and so serious that it ended her life. That was one of my regrets as a guardian, that I couldn't have advocated stronger. But there are times when you can't fight physicians, especially when surgery has to be done in a short period of time. And later on, I'll share another story about that. So let's talk about why you as a guardian will have battles with the healthcare system. It's the difference between what a healthcare provider sees as clinical capacity and what the legal system sees as legal capacity. Clinical capacity for a healthcare provider means that a person can say yes. It means that they can consent to something. So the example I gave earlier about medications, Mrs. Smith, are you okay if I discontinue your high blood pressure medication? Mrs. Smith says yes. The doctor discontinues the medication. Or, Mrs. Jones, are you okay if we do quadruple bypass surgery on you? Mrs. Jones says yes, not even understanding what that means. Physicians believe that patients have this right to say yes. What they don't understand is, does that patient even understand what they're saying yes to? Who's going to help that patient follow through with all of this aftercare or everything that's needed? Patient rights is a huge issue when you begin working with other care providers in the healthcare industry. Because patient rights doesn't distinguish between a patient who has full capacity, who fully understands the decisions that they make, and a person who may have an agent appointed under medical durable power of attorney, or a person who may have a guardian appointed because they can't make those decisions. And here's another true story. My client, Harriet, lived in a care community. Harriet was lactose intolerant and was allergic to chocolate, even though she loved to eat it every now and then. My order to the care staff was no chocolate, no lactose products. They result in trips to the emergency room. But there were a few care providers there who felt a little sorry for Harriet, who asked them constantly for chocolate or milk. They gave her the products. What do you think happened? Harriet ended up in the hospital emergency room. Not one, but 3 or 4 times. And I began getting calls from the hospital saying, what are you doing as the guardian? Do you not know that these allergies cause her to come here? They cause distress to her body. It's hard on her system. And by the way, every time she comes, it's $1,000 or more trip, a charge to the healthcare system. Now, I had talked to the care community about this. I had to have a meeting with their staff and the owners of the care community and provide training and explain why Harriet could not have milk products and chocolate. And finally, I got through. But it took that type of education and that type of risk to Harriet, and a battle with the care providers who say, but she has a right to have these products. And no, she didn't have a right to have products that harmed her. She couldn't understand that they were harmful to her. She couldn't understand that she would go to the emergency room. She lacked that mental capability. So that's another battle that you may have with the healthcare system over patient rights and over clinical capacity. So let's talk about that for a minute, and medical advocacy. So a client of mine named Brenda, who was a client of mine for so many years, she was diabetic. And people with diabetes can eventually have a lot of issues with their stomach and indigestion and what's called GERD. And over time, Brenda began to have these issues. And a couple of times she was sent to the emergency room because they got so severe because she was vomiting and became dehydrated. She had a long-standing doctor, 26 years, amazing doctor. His name was Dr. Bradley. I loved him. Unfortunately, Dr. Bradley retired and he was replaced by a young doctor who really didn't have the experience that he did and who really didn't care about older adults the way that Dr. Bradley did, which was very sad to me. That doctor said, oh, Pamela, Brenda's been to the hospital emergency room twice. And what do you think came next? He said, I don't think we should keep sending her out. I think we should just put her on hospice and let her quietly pass away. I knew that that would not have been what Brenda wanted, so I started to do a lot of investigation. I called Brenda's family and I said, has this ever happened when she was young? What medications did she take? Did she have reactions? Were there allergies? Because there was one medication in Brenda's chart that could have been the solution to this problem, but it was marked, don't give to her because she's allergic to it. Brenda was a patient, fortunately, of the VA system, the Veterans Administration system, because she was in the military when she was younger. And I called them and I went through 10 years of her records and I said, my gosh, can you investigate this? Can you tell me what this one medication might do to her? And the only thing they found was that it could cause diarrhea. And I thought, diarrhea or death? Let's take a little bit of diarrhea and have Brenda feel better. So I went back to that new doctor and I said, doctor, would you be willing to prescribe this to Brenda? And he said, no, I'm not going to take that risk. And I said, well, if you won't prescribe it, the doctors at the VA will prescribe it because they feel that the risk-benefit ratio, the benefits are greater than the risks. You know what he did? He fired me. He said, I'm not going to work with you and I'm not going to work with Brenda. You go find another doctor. And I did. And the VA system prescribed that medication and Brenda lived for another couple of years. As a court-appointed guardian, these may be things that you run into in the care of your elderly parent. And you can't hesitate. You have to investigate solutions. You have to be willing to stand up for the rights of your parent because the healthcare system won't. They'll try to convince you to do things that are not in your parent's best interest. They'll try to convince you not to treat your elderly parent. You have to be the one that weighs those options and to make those decisions based on what you know your elderly parent would have wanted. It's a huge responsibility as a court-appointed guardian. Let's talk about medical liability. This may be one that you have already run into if you're a caregiver. There's a term called against medical orders. It's called AMA. It's a medical speak term that the healthcare system uses, and it mostly uses that to protect themselves against liability of giving you information or making a recommendation that results in unintentional harm to your parent. If you've had a parent in the hospital or a nursing home, you may have had a physician or care staff say to you, "Oh my gosh, you can't take your parent home. They need 24-hour care." And you're thinking, how am I possibly going to do that? Well, a physician saying that your parent needs 24-hour care and the reality that your parent needs 24-hour care permanently may be two different things. You as a guardian have to evaluate that. In many of my clients' cases, they did need 24-hour care, but maybe only for a period of 1 or 2 days, or maybe only for a week. And so I was available to say to the doctors, I understand you're not recommending this, but I'm going to set up 24-hour in-home care and we're going to arrange this and make it work out because I had the skills and I knew how to manage those types of care situations. So again, it's a situation where you as the guardian have to know more than the doctor or the recommending community, and you have to know how to coordinate that care, and that's your responsibility to learn. I have online courses that help caregivers learn all of these intricacies and how to manage them for elderly parents. It's called Stay at Home. You can check it out on my website. Taking this a step further, hospital providers, nursing home providers, assisted living providers can get very vested in the care of your elderly parent, and I call this ownership. They can threaten to call the police on you. They can threaten to get the ombudsman and Adult Protective Services involved because they feel that you're not making safe decisions for your elderly parent, or you are going against medical orders to do something contradictory to what they are recommending. Now, should you be afraid of this? Well, if you're not doing your job, absolutely yes. If you're doing your job, if you're being thorough, if you are evaluating the information, if you are making sure that your parent is safe in spite of what they're recommending, bring it on. I had hospitals call the police on me, the ombudsman, Adult Protective Services. Fortunately, because I had taken care of so many clients, I knew all of these care workers. And when they would call me because they had to investigate the cases, they would say, "Oh, Pamela, can you tell me what you're doing just so I can document this?" And most of the time they found it to be reasonable and there were no issues. So I was never afraid to be questioned or to have these people call me to investigate care because they have that right. As a guardian, anyone can question your decisions. So what you want to avoid is if you're going to do something against medical orders, you have to do whatever it takes to make sure that your parent doesn't have a repeat condition that takes them back to the hospital. You have to put measures in place, caregivers in place, do whatever it takes. Because if that happens, then it shows that you may not be doing what is in the best interest of your parent. So another story about clinical capacity, and this was another care situation that I lost. I was the guardian for this gentleman who had had heart issues over the years. His heart was becoming so weak that even medical treatments and even a pacemaker was not the solution. The doctor said to me, "Pamela, I could put in a pacemaker, but it's not going to work. I don't know that he would survive the surgery for the pacemaker. And it's not the solution. One day, this client is just, his heart's going to give up. He's not going to wake up, and that will be the end of his life." And I talked to my client about that, and he understood. But he had dementia, so he couldn't remember conversations. He was living in an assisted living community. They sent him to the hospital because one morning he was unconscious and he was very close to not waking up. I suspect he was very close to passing away in his sleep. The doctor calls me and said, "Oh, Pamela, I want to put a pacemaker into your client." And he agrees. There you have it, clinical capacity. "John, would you like a pacemaker?" John says, "Oh, of course I'd like a pacemaker." So I spoke to the doctor and I said, "Doctor, he has a cardiologist. I can send you all of the records. I can send you his heart tests. I can show that a pacemaker is not recommended because his heart is already so weak, and we don't even know if he would survive the surgery." The doctor disagreed with me, and I'm not sure if it was out of worry about medical liability or if it was the fact that the hospital honestly wanted the money for that surgery. And it was a situation of timing and disagreement. I knew that that pacemaker was not going to make a difference. To overturn the doctor's decision, I would have had to have gone to the hospital ethics committee, had meetings that lasted for days, and spent a lot of my clients' money to do that. So rather than take it up to an ethics committee, I allowed the surgery to happen. The other things that the doctor didn't consider was, after the surgery, there's follow-up for pacemaker. Could my client physically go back and forth to the doctor to have the pacemaker checked? Could he do all of the follow-up to make sure that the pacemaker was working? He couldn't. He didn't have the mental capacity to do that. 2 weeks later, my client didn't wake up. No surprise to me, and actually a blessing. And I could have gone back to that doctor and said, "Look at what you did." It didn't make any bit of difference, but I let it go. There are places and times for disagreements with doctors, and there are points where making a ruckus or making a fuss or causing trouble isn't going to make a difference. And again, that's something that you as a guardian have to look at. Do I advocate for this, or do I let it go knowing that the outcome is going to be the same regardless of what I do? And you have to make peace with yourself on those issues, because as a guardian, you do feel emotional. You feel bad when a parent passes away. I've had many clients pass away over the years, and I was very honored to care for all of them. But it is always sad when you lose somebody who's been a part of your life for such a very long time. And when that's an elderly parent, it's even harder. One of the reasons that I do this type of advocacy is that both of my parents passed away more than 25 years ago. I wish that I had the knowledge that I have today back then, because their health and their care and their lives would have been so different. I could have done a lot of things. That's why I'm here today, helping you understand what it takes to get guardianship of an elderly parent and what it means to truly be that guardian. The positive effect that you can have on the life of an elderly parent or another adult is truly amazing. The stress that you will experience from doing that is truly significant. Most caregivers, most guardians, most people who serve as agent under power of attorney, they have more health issues than the health of the people that they are caring for. The reason that I didn't is because I learned from the experience of my parents and all of their health issues. And I'm very insistent, very much an advocate for my own health care, and I take care of myself as my elderly parents did not. So let's talk about, do you really need guardianship, or can you be that medical durable power of attorney forever? It depends. It depends on the level of disagreement that you think you will face from your family members and other people in the healthcare system. If your parent has a lot of health issues, takes a lot of medications, needs a lot of medical care, and they can't make those decisions for themselves, court-appointed guardianship may be the way to go, because it does give you more power to make those decisions and choices. Now, as I've illustrated through my own personal stories, sometimes it always doesn't work out the way that you expect. But you have to be willing to be that advocate. You have to be willing to fight the healthcare system. Can you trust the care providers that you work with? That's another question to ask yourself. If you have a good geriatrician and longstanding doctors that you feel that you can work with and who will work with you, you'll face less adversity in trying to work with the healthcare system. If your parent, though, lives in a healthcare community, assisted living or a nursing home, there can be a revolving door of medical providers. Guardianship may be better in that case. And I want to share the story of how families can cause problems if you are the guardian. This is a story of Peg and Tom. I was Peg's agent under medical durable power of attorney for years. And originally, I didn't do a lot for Peg. She was pretty healthy. She could make her own decisions. But I noticed over time that Peg's memory was getting worse. And I talked to Peg and I said, Peg, I'm worried about your memory. I'm worried about you living alone. Would you be okay to having an evaluation done so that we can see where your memory is and if you're safe living alone or if you need more help? And Peg agreed. So I got a neuropsychological evaluation done for Peg to tell me the degree of incapacity. And specifically in this case, I was looking for legal incapacity. Could she really make decisions? Did she understand what she was doing? And I got that report back and it said no. Peg at this point was incapacitated. She couldn't make decisions. That report helped me know what to do as far as her care. I moved her into an assisted living community and eventually to a higher level of care. Tom, her son, all of these years, didn't get along with his mom. In fact, he was somewhat verbally abusive and threatening. And Peg was afraid of him, but she would really never say a lot because she wanted to preserve that relationship. The assisted living communities would tell me about things he had done, and I would have to have conversations with him. And I tried my best to get along with him, even to the point that when I got that report saying that Peg was incapacitated, I gave him a copy. Now, you as a guardian have the responsibility to support family relationships because they're important. Those relationships have been in existence since your brothers and sisters were born. So over time, Peg needed more and more care, and I provided the care through support with assisted living and care providers. And one day, the assisted living community called me, and this is a call that you might receive as a guardian. They said, Pamela, we got notice that Peg's son petitioned for guardianship, and your name is nowhere on this document as a medical power of attorney. The hearing is in 10 days. What are you going to do? We can't have this happen. He is abusive to Peg. I really had to think about this one because it was another situation of what I call a battle. As a professional fiduciary, those of us who have a lot of experience are expected to be able to handle these situations if we can without hiring an attorney because of the expense to our client. So my first decision was going to be, am I even going to do anything about this, or am I just going to let the hearing happen and not attend? Because of my relationship with Peg and because I knew what she would have wanted done, she had never wanted her son to be responsible for her care. I decided that I was going to enter an appearance to appear at the hearing and represent myself legally. Now, I needed help though. I knew the county attorney. I called the county attorney and I said, here's the situation. I have to represent myself. I need to be able to call witnesses. Can you subpoena people for me? Will you do that? And she agreed. So she subpoenaed 3 people. The past staff at the assisted living community, the current staff at the assisted living community, and Peg's attorney who her son Tom had her fire. So it's the day of the hearing. I'm there. I'm acting as an attorney, even though I'm not an attorney. I call witnesses, just like an attorney would. I called the first assisted living community staff, and they verified that during the time that Peg lived there, Tom was verbally abusive. He physically yelled at Peg, yelled at the staff, would show up at all hours of the day ranting and raving. The second assisted living community staff was up there, and this person was the owner of the community where Peg currently lived. I can tell you she would have done anything not to have to appear because Peg was going to continue to live there, and she was going to continue to have to work with Tom regardless of what she said. She relayed a story of Tom swinging a phone by the cord in the air, threatening to hit Peg, and all of the other behaviors. My third witness was Peg's attorney who Tom had her fire. Now, if you know anything about client-attorney privilege, attorneys can't share a lot of information because it's confidential. But the one question that I could ask this attorney that she could say was the one that I believe turned the case, in addition to the fact that I got that clinical, or that I got the legal statement of incapacity from a neuropsychologist. The attorney was on the stand, and I said to the attorney, "You have known Peg for 15 years. You have prepared all of her legal documents, her medical power of attorney, her financial power of attorney. In any of these documents, did she ever appoint her son, Tom, to be that responsible party?" The attorney's answer was, no, she did not. That was the one question I could ask. So the judge considered all the evidence. The judge considered that 9 months ago, Peg was deemed incapacitated, meaning that she couldn't understand information or make decisions. So her son saying that Peg wanted him to be guardian was considered invalid because of that statement of legal incapacity. The other support I had was that her son was confirmed to be abusive, not by one, but by 2 assisted living community staff members. And 3, the fact that Peg never, ever appointed her son in any of her legal documents meant that that judge voided the guardianship hearing, said that my medical durable power of attorney stood for the remainder of Peg's life. So I didn't need to go for guardianship. But everything that I had done and everything that I had known to do before that supported that ruling. Had I not taken Peg to see a neuropsychologist to obtain that statement of legal incapacity 9 months earlier, that hearing could have gone totally differently. This is why, as a guardian, it is important for you to care plan. It's important for you to continually seek evaluations of your elderly parents, the degree of their memory loss, what they're able to decide, what they're not able to decide. As you can see from all of this, being a guardian is work. It's a serious responsibility. My goal is that you never say, "Nobody told me this, and I didn't know to ask these questions." I'm Pamela D Wilson. My website is PamelaDWilson.com. On there is a lot of helpful information, my radio show podcasts, and more educational programs that you can find on my website or on this link, support.PamelaDWilson.com. My stay-at-home course for caregivers, it's called Taking Care of Elderly Parents, Stay at Home and Beyond, gives you all of the intricacies, all of the details of everything that I am explaining to you in how I managed care for my elderly clients. Thanks for being here. I look forward to seeing you in the next webinar for how to get guardianship of a parent.